If you're over 70, there's something you need to hear, and most doctors will never say it out loud. Every single year, millions of seniors faithfully line up for medical checkups believing they're protecting their health. They trust that more tests mean more safety, more scans mean more years, more procedures mean prevention. But what if the opposite is happening? What if some of the most common routine checkups for seniors are quietly pushing people toward unnecessary surgery, irreversible complications, and even cancer? New research reveals a disturbing truth. Up to 37% of medical tests performed on adults over 70 lead to unnecessary treatments, harmful side effects, or lifelong complications. Even more alarming, at nearly 99% of seniors have no idea they're being overtested. One test on today's list, the number one test, is now estimated to be responsible for 5% of all cancer cases in the United States, putting it in the same category as daily alcohol consumption. And yet, it's still marketed as preventive. You won't see this truth on clinic posters. You won't hear it in a rushed doctor's appointment, but it is buried deep in the science. Today, we're exposing it. In this video, you'll discover 5 health checkups seniors over 70 should seriously reconsider, and the frightening reality of what they can do to your body, all backed by real medical studies. And wait until you hear number 2. Most people never see it coming. Before we begin, tell us in the comments, where are you watching from? How old are you? Have you ever regretted a medical test or procedure? Do you feel seniors are tested too much? We read and respond to every comment and with personalized insights. Now, let's begin. At first glance, this one seems harmless. A quick scan, no pain, no needles, just answers. The bone density scan, officially called a DEXA scan, is designed to measure bone strength and detect osteoporosis. Doctors often present it as a responsible step, especially for women over 70. But here's what almost no one explains. After age 70, bone density scans frequently create fear without providing real benefit. Why? Because bone loss is a natural part of aging, just like wrinkles or gray hair. Nearly every older adult will show some degree of bone thinning on a scan, even when their actual fracture risk is low. And once that number appears on a screen, a dangerous chain reaction often begins. Doctors prescribe medications called bisphosphonates, drugs meant to strengthen bones. But these medications come with serious risks. Jawbone necrosis, where the jawbone begins to die. Severe acid reflux and esophageal damage. Unusual brittle fractures that occur without warning. Here's the most shocking part. A study published in the Journal of the American Geriatric Society followed over 200 women aged 70 and older. After 5 years of treatment with bisphosphonates, fracture risk dropped by just 0.3%. That's not prevention, that's statistical noise. Meanwhile, medication side effects were common: digestive injury, chronic pain, and long-term inflammation. Let me tell you about Rose. Rose was a 76-year-old retired piano teacher. Active, independent, no history of falls. She walked daily and felt strong. During a routine visit, she was sent for a DEXA scan. The result? Osteopenia, a mild bone density reduction that is not osteoporosis. Her doctor immediately prescribed alendronate. Within 3 months, Rose developed severe acid reflux and jaw pain, so intense she stopped playing piano altogether. Her quality of life collapsed, not because of fractures, but because of the treatment. When we reviewed her case, we stopped the medication. Instead, we focused on vitamin D optimization, weight-bearing resistance exercises, balance training, a calcium-rich diet from real foods like sardines and leafy greens. 1 year later, no fractures, stronger legs, better balance. And she was back at the piano. A 2022 study in Osteoporosis International confirmed this approach, showing that exercise, nutrition, and fall prevention reduce fractures by over 20%, far outperforming medication in healthy seniors. A number on a scan should never dictate your future, and if this test can quietly damage quality of life, the next one can trigger something far worse. Brain surgery. This test destroys more peace of mind than it saves. When a senior forgets a name, misplaces keys, or walks into a room and forgets why, fear instantly takes over. Is this dementia? Is this Alzheimer's? Doctors often respond with one reflexive move. Order a brain MRI. It sounds advanced, reassuring, high-tech. But here's the truth no one prepares seniors for. Brain MRIs rarely explain mild memory problems after 70. What they do explain is how fear spreads. Most MRIs in older adults show abnormalities that are completely normal for aging brains. White matter spots, mild brain shrinkage, tiny vascular changes. These findings sound terrifying, but in reality, they're seen in the majority of healthy seniors. Here's the danger. Once something abnormal appears on a scan, it changes how doctors treat you forever. More tests follow, then referrals, then invasive procedures. A 2021 review published in Neurology Today analyzed over 3,000 MRI scans in patients aged 70 to 85 with mild memory complaints. The results were alarming. 86% showed brain abnormalities. Only 3% were linked to a truly treatable condition. Yet 12% were sent for invasive follow-ups. Spinal taps, biopsies, hospital admissions. That means 97% went through fear for no benefit. Let me tell you about George. George was a 74-year-old retired engineer. Sharp, independent, social. He noticed mild forgetfulness. Nothing unusual for his age. His doctor ordered an MRI. The scan showed white matter changes. George was never told these were age-appropriate. Instead, he heard one sentence that changed everything. "We see something." From that moment on, George believed his life was ending. He stopped driving, stopped going to church, stopped making plans. His memory got worse, not because of disease, but because of fear and anxiety. When we reassessed him using simple cognitive screening tests, pen and paper exams, his results were completely normal for his age. Once he understood the truth, focused on sleep, hydration, and stress reduction, his memory stabilized within months. Here's the reality. Unless there are red flags, seizures, sudden personality change, rapid loss of daily function, an MRI is usually the wrong first step. A simple cognitive test is safer, cheaper, and far more accurate at determining whether memory changes are dangerous or normal aging. But now we're moving into even riskier territory, because the next test is one millions of seniors get every year without questioning it. Checkup number 3, cardiac stress tests. This test has sent more healthy seniors into operating rooms than most people realize. The cardiac stress test is often ordered when someone over 70 says, "I feel more tired. I don't have the same stamina. I get winded on hills." Sounds responsible, right? But here's the problem. After 70, stress tests produce false alarms at alarming rates. In seniors, the false positive rate, meaning the test shows a problem that doesn't actually exist, can reach 40%. And false alarms don't end with reassurance. They end with angiograms, contrast dyes stents, bypass surgeries. A major study in JAMA Cardiology revealed something shocking. More than half of stents placed after stress test referrals were done in patients who had no clear symptoms, gained no improvement in survival, experienced no quality of life benefit. What they did gain? Bleeding complications, kidney damage from contrast dyes, long hospital stays. This happened to Raymond, a 75-year-old retired postman. He walked daily, felt healthy, mentioned mild fatigue uphill. One stress test led to another test. Another test led to catheterization. A mild narrowing was found, like a stent was placed just in case. That night, Raymond's kidneys reacted to the dye. 6 days in the hospital, weeks of recovery. His fatigue never improved because his heart was never the problem. If you're over 70 without classic cardiac symptoms like chest pain during exertion or severe shortness of breath, a stress test can do more harm than good. Safer alternatives often include resting EKG coronary calcium scan, low radiation. But once the stress test starts the process, it's hard to stop. And now, we've reached the test that shocks most people when they see it on this list. This one shocks almost everyone. For decades, colonoscopy has been sold as the gold standard of cancer prevention, and for younger adults, it can be life-saving. But after 70, and especially after 75, the balance quietly flips from benefit to danger. Here's why no one warns seniors. The preparation alone can be harmful. Before a colonoscopy, patients must drink powerful laxatives that flush the body completely. In older adults, this often causes severe dehydration, dangerous drops in blood pressure, electrolyte imbalances, kidney stress, then comes sedation. Sedation in seniors is not benign. It increases the risk of confusion and delirium. Falls in the days after the procedure, long-lasting cognitive decline, and then there's the procedure itself. A 2019 study following 1.3 million Medicare patients aged 70 plus revealed a disturbing reality. For every 1,000 colonoscopies performed in patients over 75, 2 lives were saved. Over 20 people suffered serious complications. That's a 10-to-1 harm-to-benefit ratio. Even worse, like many of the polyps found in seniors are slow-growing. Some would take 10 to 15 years to ever become dangerous. Time many older adults simply don't need to trade for risk. Let me tell you about Dana. Dana was 73, active, running a small bakery with her daughter. No symptoms, no bleeding, no family history of colon cancer. But her new doctor insisted it's routine. During the procedure, a small polyp was removed. That night, Dana collapsed from pain. She had suffered a bowel perforation, a known but rarely discussed risk. She spent 9 days hospitalized, lost weight, strength, and confidence. She never fully returned to her previous energy. When her records were reviewed, something disturbing emerged. She had already had 2 clean colonoscopies in the past. There was no reason to repeat it. Most people never hear this, but current guidelines are clear. Routine colon cancer screening should stop at 75 for most people. And for seniors who still want monitoring, a simple FIT stool test done at home often provides enough information. No prep, no sedation, no hospital, no perforation risk. But once you're sent down the colonoscopy pipeline, backing out becomes very hard. And now, we've reached the most dangerous, most overused, and most deceptive test of them all. Almost every senior has heard of it. Many have already done it. Checkup number 1, annual full-body CT scans. This test is sold as prevention. In reality, it may be creating disease. Full-body CT scans are often offered by private clinics and executive health programs as a way to catch cancer early. But here's the terrifying truth. There is zero evidence that full-body CT scans save lives in healthy people without symptoms. What they do deliver is radiation, a lot of it. Each full-body CT scan exposes you to 10 to 20 millisieverts of ionizing radiation, the equivalent of up to 500 chest X-rays in one session, and radiation damage accumulates. A 2023 modeling study published in JAMA Internal Medicine revealed something staggering. The explosion of CT scanning may now account for up to 5% of all cancer cases in the United States. That puts CT scans in the same cancer risk category as daily alcohol consumption. 1 out of every 20 cancers may be caused by a scan meant to protect health. And that's not even the worst part. Full-body scans almost always find something. Tiny nodules, benign cysts, calcifications, harmless scars. But once something appears on a scan, panic begins. More scans. Then biopsies, then procedures. Let me tell you about Marcus. Marcus was 80, active, teaching martial arts to other seniors. He felt great, but signed up for a Senior Elite full-body scan package. The scan found a 3-millimeter lung nodule, far smaller than a grain of rice. Doctors escalated immediately. Oncology referral PT scan needle biopsy. The result? Benign. But the biopsy collapsed part of his lung. Marcus spent weeks hospitalized and months recovering, all for something that never needed to be touched. Medical authorities are clear on this. Full-body CT scans should never be used for routine screening in people without symptoms. If there are real warning signs, unexplained weight loss, coughing blood, visible masses, targeted imaging makes sense. But scanning the entire body without direction is like searching for treasure with a landmine detector. You might find something, but the damage may be worse than the disease you were trying to avoid. Final truth. Seniors must hear. Modern medicine is powerful, but more testing does not mean more health, especially after 70. Sometimes the most dangerous words in healthcare are, "Let's just check to be safe." Before any test, ask, what happens if something unclear is found? Will this result change treatment? Are the risks greater than the benefit? Real prevention starts with lifestyle, movement, nutrition, sleep, stress control, not fear-driven screening. Now we want to hear from you. Have you, or someone you love, ever suffered complications from a medical test that turned out to be unnecessary? Tell us your story in the comments. We read everyone. Thanks for watching.